Assalamu alaikum. Today we will discuss about HMPV, the next virus to watch. Is this virus the next big health concern? There is a respiratory virus that is making headlines, and it is quietly affecting thousands of people worldwide. And this virus is HMPV, Human Metapneumovirus. But how dangerous is it? And could it be the next big health concern? Let's explore. What is HMPV? It was firstly identified in 2001, and this virus is a part of Paramyxoviridae family, closely related to RSV. How it spreads? HMPV कैसे स्प्रेड होता है? It spread from an infected person to other through secretion released during coughing or sneezing, or it can spread through close personal contact such as touching or shaking hands, and it can spread through touching contaminated object or surfaces and then touching your mouth, nose or eyes. Why is HMPV concerning? Recent outbreaks have highlighted HMPV as a growing concern. Hospitals are seeing more severe cases, especially in young children, older adults, and people with weak immune systems. And this virus often gets misdiagnosed as RSV or the flu. सो ये वायरस मेनली अफेक्ट किन को कर रहा है? उन लोगों को जिनका इम्यून सिस्टम वीक है, या ये यंग चिल्ड्रन में इन्फेक्शन कॉज कर रहा है, या ये ओल्डर पीपल को अफेक्ट कर रहा है. वाई आर HMPV केसेस राइजिंग इन चाइना? सो ये चाइना में क्यों इसके केसेस ज़्यादा नज़र आ रहे हैं? ह्यूमन मेटान्यूमोवायरस केसेस हैव बीन राइजिंग इन चाइना, पर्टिकुलरली इन नॉर्दर्न रीजन्स सिंस December 2024. There are several factors that contributes to this increase. First is seasonal trends. So क्या है कि winter months में ये ज़्यादा respiratory infections होती हैं. Winter months typically see a surge in respiratory infections. The recent rise in HMPV cases align with this seasonal pattern noted by WHO. सो ये सीजनल वायरस है कि ये विंटर मंथ्स में आता है. अपने इन्फेक्शन जो है वो विंटर मंथ में इसकी इन्फेक्शन होती है इस वायरस की. सेकेंड जो फैक्टर है वो है पोस्ट कोविड-19 डायनेमिक्स. द कोविड-19 पेंडेमिक डिस्टरप्टेड रेगुलर एक्सपोजर टू वायरसेस एज रिस्ट्रिक्शंस वर लिफ्टेड, रिड्यूस्ड इम्यूनिटी इन पॉपुलेशन रिजल्टेड इन अ रीबाउंड इफेक्ट, making people more vulnerable to respiratory infection such as HMPV. Is HMPV spreading in UK? So UK में भी इसके कुछ cases नज़र आए हैं. HMPV cases in UK have been steadily increasing since October 2024. While the UK Health and Security Agency does not release specific case number, recent data shows a sharp rise in percentage of positive tests in third week of December, with levels remaining high the following week. Now move towards the symptoms and risk factors. So इसके symptoms कौन कौन से हैं? Such as fever, cough, nasal congestion, shortness of breath. मोस्टली यही होते हैं और ये माइल्ड सिम्टम्स होते हैं और उसके बाद ख़त्म हो जाते हैं, वायरस निकल जाता है बॉडी से. बट फॉर हाई रिस्क ग्रुप इट कैन लेड टू सिवियर कॉम्प्लिकेशन लाइक ब्रोंकाइटिस और निमोनिया. सो कुछ लोगों में कॉम्प्लिकेशन हो सकती है, सच एज निमोनिया हो सकता है, ब्रोंकाइटिस हो सकता है. इज HMPV द न्यू पेंडेमिक थ्रेट? HMPV is not a pandemic threat. Although it affects vulnerable groups, it spreads more slowly and follows seasonal pattern. So ये seasonal specific virus है और ये slowly spread होता है, इसीलिए it is not a pandemic threat. और ये नया वायरस नहीं है, ये पुराना वायरस है. It has been around since 2001 and most cases are mild, while it remains a concern especially for high risk individuals. It is unlikely to cause a global outbreak like COVID-19. So ये pandemic, it is not a pandemic threat. Prevention and what you can do. You have to wash your hand, avoid touching eyes, nose or mouth with unwashed hands. Avoid close contact with people who are sick. So the patient who have cold-like symptoms, what should they do? They should cover their mouth and nose when coughing and sneezing. They should wash their hands frequently. They should avoid sharing their cups and eating utensils with others. They should stay at home when they are sick. HMPV may not be the next COVID-19, but awareness is the key to staying safe. So this lecture was about HMPV. Hope you like this video. Thank you and Allah Hafiz.